Now we move on to health. We have Dr. Olatubi Olawale, who is a physiotherapist with specialty in sports medicine and orthopedics rehabilitation. And we'll be discussing lower back pain. Mazino is extremely interested in this. So I don't know why he's not the one here, because he probably would have maybe get down, take off the clothes, and you deal with his lower back pain, because he's like 60-something now. But hey, lower back pain, first of all, is it concomitant? Is this something that comes with old age? Is it confirmed that lower back pain, old age?
No.
No. Huh? You have given Mazin escape routes now.
It is said that at least you must have low back pain at least once in your lifetime.
Once in your lifetime?
Yes. At least once in your lifetime.
What's the lowest age you can have lower back pain?
It can start from any age.
It can start from any age?
It can start from any age. It can be traumatic. Injury can happen to you.
So when you say once in your life, how long would it last? If let's say to that person that it happens once, is it something that maybe comes and goes the day after? Like, because me, I feel like my own has come and gone. So I just want to be sure.
Yeah, back pain is actually categorized to two.
Okay.
Acute and chronic.
Okay.
So the acute one is maybe 2-3 days. The symptoms come and it goes.
And it go, yeah.
The chronic one is after the pain's still there after 3 months, 6 months, 1 year. That's the chronic back pain.
That's the chronic back pain. All right. Are there things that cause it, or like you said it must come at least once, okay? But then when it gets chronic, are there things that you do that make it last that long?
Yeah, the back pain, actually, the lower back pain, because the lower back actually takes the weight of the body.
Okay.
All the weight of the body is rested on the lower back.
On the lower back,
so
yeah.
the chronic back pain now, for pain that is there for 2-3 days and you are not being attended to, but you need to know the cause. What is causing this back pain?
So what are the causes? That's why I wanted to.
Okay, the causes of back pain now, it can be traumatic. Can be an accident, I have an accident or a fall.
Okay.
Or I was trying to lift something heavy and I had a snap.
That was my own. I had this story I told them. I saw one young lady at the gym. She was doing squats with weights. And the way she was doing it, the weight looked like, this thing are nothing now. Auntie went away, I now went there. I just heard, for 10 minutes, I was like this. I was just forming myself, I was observing the gym. Meanwhile, I heard something there. But it came and went for a while, and I tried to stretch and all of that. Are there exercises that you can do that will reduce the lower back pain?
There are a lot of exercises that you can do to reduce the lower back pain.
All right.
The major kind of exercise to do is stretching exercises.
Stretching exercises, okay.
Stretching exercises, then also strengthening exercises, because the muscles of the back are actually weak. So sometimes they may be weak for you to be able to take the pressure of the back. So strengthening exercises to the lower back.
Okay, you can see some of those postures there. Mazino is on his phone. He should be looking now at this one. Really? Okay, so well, you bend and stretch and all of that, and those are the things that you can do.
To talk about back pain, if we want to really dissect back pain, we have to get maths here. We start doing a lot of things here. But the thing about back pain, what people need to know about back pain is that they need to know the cause of the back pain, and it can be. I said it can be trauma, and back pain can actually result probably from nerve compression. Maybe
what do you mean by nerve compression?
Okay, now if I explain the anatomy of the back, that's another story. But the anatomy of the back, there's a nerve coming out from the vertebrae, which radiates down to the legs. Okay. So now each time there's a compression on the nerve, either by the intervertebral disc. Intervertebral disc is the disc in between the vertebrae, the lower, like a rubber, it's like a shock absorber. Okay. If there's a compression of that disc on the nerve, it irritates. Yeah, if you see some tingling sensation, we call it paja, tingling sensation, burning sensation, radiating to the leg. That's another cause of low back pain. The another cause of low back pain can be degenerative. That's where the old people comes in, because your back when you're getting old, the way you use your back, when you're getting old, the things actually getting tired. Like, I'm tired. So
exercises can strengthen it. If you were maybe quite active while you were younger, growing, it might not be as degenerative as somebody who was not active, right?
Yes, that's it. You must be active. Because if you're active, your back muscles are strengthened, the joints are okay, but you shouldn't overdo.
You shouldn't overdo.
You shouldn't overdo
when it comes to
exercises, to activities. Because when you overstress your back, it puts a lot of strain to you at the long run.
A long run. Okay. Someone is asking me about driving. For people who sit down and maybe drive too long and all of that,
That's another cause of back pain. Because,
that's another cause, yeah.
You see people working in the office sitting for 8 to 10 hours.
Sitting, yeah.
When you sit down without a back support, the pressure on your back is like ×2 of standing up, because the pressure goes to the back when you sit down.
So I'm thinking that when I sit down, I should be more comfortable than when I stand up. But you're telling me now
when you sit down,
okay,
the pressure on your spine, on your lower back, is more than when you stand.
Okay.
But when the truth about sitting is that you try to do not sit for more than 40-45 minutes.
Wow.
In one position.
But Lagos traffic is not helping.
That is it.
If I'm going from Ikorodu to Aja, there's so many activities every day, and there's only 5 hours. I don't want to stand up inside the car. If I park the car and come down,
I do tell my clients, like, okay, see, if you're driving, and you're having back pain, if you're driving for like 1 hour, you can recline your seats back. You've changed the position, you've changed the dynamic. Recline your seat. After like 10 minutes, you can recline your seat again. Then maybe you can just branch the gas station, get fuel, or you can just branch and do something. Just change.
Doctor, you have not entered some traffic. This one. Branch way.
Yeah.
When you branch, you find out that.
It's just the environment you find out.
All right, thank you so much. It's always a pleasure having you, and probably we'll continue on this, so we have to go now.
Yeah, thank you very much.
All right, hope you're able to pick up 1 or 2 things there. That's how to deal with lower back pain, and probably how you can maybe help yourself. That's all on health for today. We'll take this time out now, and when we get back, we have a final guest. Stay with us.